Good afternoon, class. Welcome to Nursing 401. This week we're going to go over Chapter 95, Substance Abuse or Substance Use Disorders. So what is substance abuse? Substance abuse is some individuals respond to stress by using harmful mood-altering chemicals. Recognizing and caring for those with addiction requires a high-level nursing assessment, nursing skills, patience, and compassion. Diagnosis of substance use disorders. It is a maladaptive behavior of substance use, clinically significant impairment or distress with one or more of the following in a 12-month period: health problems, disability, failure to fulfill role obligations, use that presents a danger, recurrent use related to legal problems. Recurrent use can be related to legal problems. Remember, recurrent use can be related to legal problems. Continued use despite related interpersonal problems. Their spending increases, which jeopardizes their finances, and they combine overuse with other compulsive behaviors. Chemical dependency can be classified as active, in remission, not currently active but still existing on agonist blocking therapy, or in a controlled environment. Substance use disorders can be fatal and usually worsens without intervention. Causes. There is no sole causative factor identified. Physical factors theories. Excessive consumption of substances is the most obvious cause. Genetic, based on direct biologic transmission or as a learned behavior. Emotional and psychological theories. Stress, according to them, stress is a contributing factor. Low self-esteem is often the most precipitating factors, and difficulties in interpersonal relations. General uneasiness and dissatisfaction with life. Low tolerance for frustration and tendency towards excessive and self-destructive acts. Coexisting mental illness. That is, in many cases, coexisting mental illness. And dual disorders. They also have a coexisting mental illness. So remember, coexisting mental illness in many cases, could be related to one of the factors of substance or chemical dependency. And a lot of times they will use substances to feel better, or to stop feeling depressed, or to escape life. The nature of substance use disorders. It is a progressive nature, corresponds to their psychological causes. Defense mechanisms. Most pertinent to substance use disorders. Defense mechanisms. You have denial, rationalization, and projection. Denial is they deny difficulty in controlling. They usually, deny that the drug use is causing problems long after others realize the person's out of control. Their dual rationalization. They'll argue they don't have a problem. I cannot have an alcohol problem because I do not use during the day. I have a good job. I only use on weekends. I never drink before 5 o'clock. I can quit whenever I want. Or projection, where they blame others. If you were a better parent or spouse, I would not have to drink. If my kids were better behaved, I would not need drugs. It's my fault. It's not my fault. It's blank's fault. Back to the progressive nature. Their typical progression is I use it to feel better. That is in the early stages of substance use. It alleviates the person's feelings of low self-worth and stress. They use it to escape and feel better. The second is I use it to keep from feeling bad. As the disorder progresses, the person must use increased amounts of the substance to stop feeling sick or depressed. Remember, I use it to keep from feeling better. They must use increased amounts of the substance to stop feeling sick or depressed. The person begins to need the substance to keep from feeling bad. Or the third one, I'm losing control. The person now finds that even a small amount of the chemical causes illness or severe intoxication. And they can also have blackouts, which are periods of total amnesia, often occur with excessive use. At this point, immediate intervention is vital, often to save a person's life. How do we manage it? This is on page 1770 under management. Recognition. We need to recognize the condition. The first person to do so is often someone other than the person with the disorder. Intervention. Active intervention must occur. If no one intervenes in the process, it usually escalates. Remember, intervention, active intervention must occur. If no one intervenes in the process, it usually escalates. Treatment. They often respond to structured therapy, usually needs assistance to stop using. Treatment should include positive self-enhancement and abstinence. And then recovery. There's AA, or Applied Principles of Behavior Modification. But remember, in management, intervention, active intervention must occur. If no one intervenes in the process, it usually escalates. So older adults are not at risk for substance abuse. I know I can't see any of your faces or know what you're thinking, but that is false, because research shows that over 33% of emergency department admissions and 20% of acute hospital admissions of older adults can be traced to complications related to substance abuse. Many seniors overuse prescription meds, over-the-counter drugs, or alcohol as a result of loneliness, depression, or confusion. Seniors often live alone, and the problem is not recognized until it has become very serious. Nursing care measures. Identification of the chemically dependent person. Be alert for signs and symptoms of substance abuse or overuse or withdrawal in all clients. Be alert for cross-dependence. Abusers of one substance often have built up tolerance to related drugs. Nursing data gathering. It can be incorporated naturally into every nursing interaction. You want to ask open-ended questions. The most important questions that you can ask are, when was your last drink, drug use, and have you ever had problems with withdrawal seizures or DTs? Remember, the two most important questions you can ask is, when was your last drink, drug use, and have you ever had problems with withdrawal seizures or DTs? Dealing with an intoxicated person in the healthcare facility can be challenging. We want to monitor their LOC and their orientation, but most importantly, we want to monitor their LOC. We want to watch for tremors, seizures, involuntary movements. We want to monitor their cardiac and respiratory status, vital signs, their O2 stats, and pain levels. If a person's use affects their job, interpersonal relationships, or family, they have a substance use disorder. So when we are nursing care measures, remember, two most important questions we can ask: when was your last drink or drug use? And have you ever had problems with withdrawal, seizures, and DTs? And the one thing we really want to monitor is their LOC. We're going to monitor cardiac and respiratory, vital signs, O2 stats. We're going to watch for all of that, but we really want to monitor that LOC. We want to observe for life-threatening withdrawal symptoms for at least 96 hours. The cardinal sign is loss of control or inability to stop drinking or using. Assessment priorities. Behavior changes. Physical signs, withdrawal symptoms. You will find those on page 1774 and 1775. And there is a table 95-1. It goes through all different types of withdrawal, from alcohol to sedatives, hypnotics, analytics, heroin and other narcotics, and amphetamines, stimulants, and related drugs. Possible nursing diagnoses are on page 1773. The one you want to particularly pay attention to is a high risk for violence, self-directed or directed at others. Because remember, individuals with substance or chemical dependency can show behavior changes. Planning. That is also on page 1773. What are we going to do in our planning phase? We want to make sure that they safely detoxify, they agree to participate in treatment program, and they agree to continue with aftercare. Implementation. Refer the client to a psychiatric liaison nurse or drug treatment counselor. Support the client's family. Encourage them to seek help by contacting a support group such as Al-Anon. In some cases, intervention and forced treatment may be required, and you strongly recommend the client follow up in a support group, such as AA or NA. And then evaluation. The adequacy of the plan is determined by evaluating the client's achievement of stated goals. But on page 1775 for mydriasis, I want you to know that means dilated pupils. And then this is for amphetamines on 1775. Amphetamines, crack, uppers, methamphetamines, etc., etc. They will have increased vital signs. They will have mydriasis, which is dilated pupils. They will have lack of enjoyment or anhedonia. Life-threatening. They will have respiratory depression and seizures. So another question for you guys. Another one. A person's frequency of drug use is the best criteria for determining whether they are chemically dependent. That is false. Explore the role that drugs play in the individual's life. Loss of control or inability to stop drinking or using is a cardinal sign of chemical dependency. If a person's use affects their job, interpersonal relationships, or family, they have a substance use or chemical dependency. Detoxification. It's a process of removing a drug and its physiologic effects from a person's body. Goals in detoxification is comfort and safety. It may take days depending on the drug used and the amounts and their dependence level, liver and kidney function, and client's size and health to remove the effects from the person's body. Comfort and safety, that is most important. We want to use sedation and emotional support to allow the client to rest and recover to prevent injury or exhaustion. Treatment depends on substance use. Detoxification must occur before long-term chemical dependency treatment can begin. When a person reduces intakes of drugs, such as barbiturates or cocaine, the future danger of overdose exists. So when a person reduces intake of drugs such as barbiturates or cocaine, the future danger of overdose exists. And that is because a lot of times when they reduce their intake, when a person stops taking like drugs such as barbiturates or cocaine, the future of the danger of overdose exists, because normally what happens is they'll stop using the drug. Sorry about that, guys. They'll stop using the drug. Their tolerance is reduced, but then they will sometimes take it, they'll start using again, and they will take the usual dose they were using before, and they will overdose. They can overdose, and it can cause death because their body's not used to that amount anymore. Where it was before they stopped using, and then they go back to it, and they use that same amount, and their body's not used to that amount, so that puts them in danger of overdosing. Hope that all made sense. Motivation for treatment. The client must realize that avoiding relapse is almost impossible while using any amount of drug. Abstinence is the only sure method for detoxification and recovery. You have the Detoxification Center. They're often transferred to a detox center by police. Supervised. Emphasis is supportive care and referrals to continue after detoxing. And then you have the therapeutic community. Isolated from substance-oriented environment. Goal is to assist clients to address physical and emotional problems. When goals are accomplished, they're ready to begin recovery. With alcohol withdrawal, the one thing you will see with alcohol withdrawal is that is one of the most dangerous drugs to withdraw from is alcohol. Their vital signs will be elevated. With alcohol withdrawal from other drugs, their vital signs are depressed or fluctuate. With alcohol, their acute detoxification is usually complete within 3 to 7 days. Acute detox usually begins within 96 hours of last ingestion. And suicide risk increases during detoxification. So remember, with alcohol withdrawal, their vital signs are elevated, where withdrawal from other drugs, their vital signs are depressed, or fluctuate. Immediate treatment in detoxification, complete medical workup. That's very important. You want to do blood work and UA. Rating scales. You got the CWA scale. A lot of hospitals use the CWA scale. That is, before administering meds, you want to evaluate for severity of withdrawal symptoms, the meds administered or withheld based on the presence of specific factors. So the max score for CWA is 67. All factors are rated 0 to 7 except for orientation, which is 0 to 4. And so you rate them on that scale, and it systematically itemizes and quantifies the most common alcohol withdrawal symptoms and allows the healthcare worker to determine if meds are needed. The meds are given according to their score on the CWA scale. Withdrawal symptoms. It depends on the drug used, the amount, and their general health. Like I said previously, alcohol withdrawal is one of the most dangerous withdrawals. Nutrition and general health. Liver function test. Evaluate their GI function. They may need supplemental vitamins. Refeeding syndrome. That refeeding syndrome can cause cardiac failure. You want to, this is on page 1776. Careful dietary management is vital. You want to rehydrate them slowly because a sudden influx of carbs can stimulate insulin production and other events that can cause electrolyte imbalances. So you want to rehydrate them slowly. And carbohydrates, such as dextrose intravenous solutions, tube feeding mixtures, and liquid dietary supplements must be given carefully because that sudden influx of carbs can stimulate insulin production and other events that may severely upset electrolyte imbalances. Because the refeeding syndrome, like I said, can cause cardiac failure, hypertension, peripheral edema, neurological complications, respiratory failure, and death. Types of long-term follow-up and treatment. The period after detoxification is very important. Many users will have a polysubstance use disorder, or they may be codependents. Inpatient or outpatient treatment. They may be committed legally. There's special programs that are available for young children, adolescents, seniors. You've got the 12-step program. They teach untreated substance use disorder is a progressive, incurable disease. The dependent person is never cured. Rational recovery is built on the premises that an individual's value and beliefs control behavior. The dialectical behavior therapy emphasizes the here and now and assists individuals to take charge of their own lives. Dialectical behavioral therapy emphasizes the here and now and assists individuals to take charge of their own lives. Individual therapy, the goal is to work toward improving one's total life, where group therapy is core mindfulness, interpersonal effectiveness, distress tolerance, and emotional regulation. Health realization, psychological, spiritual theory. Each person possesses an inborn or innate inner health and has the capacity or ability to lead a healthy life. The goal of the health realization is to gain self-esteem. Family counseling Client and family need encouragement and support to deal with normal family stressors. Positive added challenges of recovery. And most important factor in maintaining sobriety is the aftercare. So, alcohol abuse and dependence. They're going to have slurred speech, unsteady gait, confusion, behavioral changes. Breathalyzer level is 0.08 to 0.15, and the person does not appear to be impaired. So sometimes some people will test 0.09 and they don't even appear to be impaired. This may be a person who has used for quite a long time. Remember, alcohol is a CNS depressant. A chronic alcohol user will have a swollen nose, spider angiomas on the nose and or cheeks, reddened palms, palmar arrhythmia. Chronic use can lead to impaired attention, confusion, dementia, amnesia, sleep disorders, psychiatric symptoms, or not psychiatric, psychotic symptoms, and they are at a major risk for suicide. Alcohol use causes or contributes to over 88,000 deaths a year, and it is estimated that over 15 million people have problems with alcohol. Another thing about alcohol use that I want you to remember is aspirin enhances the absorption of alcohol. Aspirin enhances the absorption of alcohol. Specific disorders caused by alcohol abuse, you have dietary deficiencies, sequela thiamine deficiency, cirrhosis of the liver and hepatitis, and other disorders. They can have esophageal varices, cancer of the mouth and the esophagus. They can have gastritis or gastric ulcers. Sexual impotence is common. And thiamine deficiency. Thiamine is vital in the breakdown of sugars. Untreated, it can cause Wernicke-Korsakoff syndrome. But their most common dietary deficiencies is vitamin B1, which is your thiamine, vitamin B9, folic acid, and folate, and that is usually part of the treatment protocol. A lot of times if you have an individual who is coming into the healthcare facility with alcohol abuse, you're going to hang what they call a banana bag, and it is nothing but it's a lot of different vitamins. There is also such a thing as alcohol, which is a powdered alcohol, and 1 ounce equals 80 calories and the same amount of alcohol. So just remember that aspirin enhances the absorption of alcohol, and their most common dietary deficiency is vitamin Bs. Treatment. Alcohol withdrawal occurs in 3 stages. If medical management is ineffective, the goal of alcohol detoxification is keep the client comfortable and as safe as possible and prevent progression into the 2nd and 3rd stages of withdrawal, which are life-threatening. So you have your stages of withdrawal. You have your autonomic hyperactivity. Objective sign of that is hand tremors. They will have an elevated vital signs. Their temp will be greater than 100. Pulse greater than 100, respirations are going to be 20 to 22. They're going to have a higher blood pressure. That is stage 1, which lasts 12 to 18 hours after their last drink. Neuronal excitation, they will have severe tremors. That is stage 2. That is 24 to 36 hours after their last drink without treatment. They can have sensory perceptual disturbances. They are critically ill at this point. They can have alcohol hallucinosis, bugs thinking that bugs are crawling on their skin. You want to also take into consideration the family, because this involves the entire family, and without interventions, children raised with a substance use disorder frequently suffer from substance use later in life. You have the codependent or enabler. They're obsessed with controlling the user's behavior. You also have recovery for the codependent. They must stop covering up and protecting the substance abuser. Enabling allows a life-threatening condition to continue. Remember, enabling allows a life-threatening condition to continue. Also, family programs, they have Al-Anon, Elatot, Elatine. And then there's medication therapy. For medication therapy, the client must be detoxified before beginning any of these meds. They have antabuse, which is an aversion therapy. They have Camprol, which is used to reduce craving. Naltrexone, used as an adjunct after detox. And then they have kudzu, which is a herbal supplement. The one I want to address here is the anti-abuse, and this is on page 1783. The loading dose is 250 to 500 milligrams per day for 2 weeks, followed by a maintenance dose of 125 to 250 milligrams until permanent self-control is established. Remember, anti-abuse, the oral loading dose is 250 to 500 milligrams per day, PO, for 2 weeks, followed by a maintenance dose of 125 to 250 milligrams per day. If a person is taking anti-abuse, drinks alcohol, even a small amount, they can become violently ill. And this drug is only used when everything else has failed. Central nervous system stimulants. Amphetamines. Amphetamines are mood elevators and appetite depressants. Ritalin, Adderall. Methamphetamines, HCl, commonly abused. It is a serious public health problem. Effects can last up to 12 hours. Physical symptoms physically, permanent brain damage, heart disorders, tooth destruction, and skin lesions. They can show agitation, aggression, paranoia, hallucinations, and delusions. Withdrawal. Psychological problems. Withdrawal is highly unpredictable and dangerous and can be life-threatening due to various drugs used to alternate the highs and the lows. So that's with methamphetamines. They may have a sensation of insects or snakes crawling on their skin. They're called fornications or meth mites. Tweaker is a meth user who has not slept for days and is in acute withdrawal, and they can be extremely dangerous. Remember, do not address your patient as a tweaker. Not really a good route to go. So just make sure that you do not, state to them, what are you, a tweaker? Just never use the term tweaker when speaking to your clients. And always take measures to protect yourself and others when working with this type person. And then we have cocaine and related drugs. There I go again, drugs. Coke, snow, flake, blow, alkaloid. It's an alkaloid derived from the cocoa plant or manufactured synthetically. A speedball is cocaine and heroin together. Water soluble, it's injected or snorted. Water insoluble, it's smoked, which is more dangerous and addictive. Symptoms are similar to amphetamines and can cause permanent brain damage, causing psychosis, hallucinations, grandiose delusions, paranoia, seizures, coma, and death. Withdrawal, they usually need one-to-one care. They get exhausted and depressed. They have a great danger of suicide, and they may be given Narcan or naloxone prophylactically. And of course, dependence may occur with the first use. There is no safe way to use cocaine. Dependence can occur with the first use. And then we have cot, which the symptoms of cot are produce depression, sedation, semicoma. It can lead to a form of DTs, increases their thirst, constipation, tachycardia, tachypnea, and epigastric disorders. Withdrawal is managed much the same as amphetamines, but it's not as dangerous. Then we have our hallucinogens. They're found in plants or produced synthetically. They're not believed to cause physical dependence, but do produce psychological dependency. The most potent is LSD. Mescaline is called buttons or cactus, and then you have your mushrooms. So with mescaline, LSD and mescaline, one of the symptoms that a client may have is macropsia or micropsia. So there's macropsia or micropsia, which is on page 1788. With macropsia, objects appear larger. With micropsia, they're smaller than normal. You might want to underline that in your book. And then also we have PCP or angel dust. Effects are similar to hallucinogens, and it can result in brain damage. Inhaling use disorder or huffing of volatile substances such as air fresheners, spray paints, glue sniffing. Death can occur quickly related to irregular heart rhythms, cardiac arrest, asphyxiation, or aspiration of vomit. Steroid use disorders or anabolic androgenic disorders, most frequently is testosterone. Withdrawal can be difficult and uncomfortable, and relapse is common. Tobacco use disorder is we have nicotine, which is contained in cigarettes, and then we have our e-cigarettes, which contains about the same amount of nicotine as smokeless tobacco, and they also use e-cigarettes for marijuana. Then we have caffeine, which is found in coffee, tea, chocolate, soft drinks. Caffeine aggravates cystic breast disease. It's also found in over-the-counter meds. It's used medically as a respiratory stimulant, particularly in an overdose of a CNS depressant, but it does not reverse alcohol's intoxicating effects. Over-the-counter drugs and herbals. Some supplements can adversely interact with prescribed medications. So as nurses, we need to teach our clients about the dangers related to self-medications. And I don't have anything on that one. Special abusers. Pregnant women. Preterm labor is common or low birth weight. They may have permanent physical or mental disorders, birth defects, and fetal alcohol syndrome. Adolescents. Peer pressure or low self-esteem. Older adults, they take double doses of meds related to confusion, or they overuse certain medications. Alcohol is fairly common. Nurses are bound by law. Nursing code of ethics and pledge taken on entering nursing to report any staff person suspected of abusing drugs or alcohol. Not reporting can be prosecuted as a crime. You will see nurses that are, signs of substance use disorders. They'll have a lot of med errors, or they'll sign out more controlled drugs than any other staff member. Because with nurses, drugs are readily available in healthcare facilities, they're at high risk for substance abuse. But remember, we are bound by law, the Nursing Code of Ethics, and the pledge taken on entering nursing to report any staff person suspected of abusing drugs or alcohol. That is the end of chapter 95. I'm going to just go through and do a quick review of information that I want you guys to make sure you locate it in your book or underline it, highlight it, star it, I don't care. Substance use disorders. Recurrent use can be related to legal problems. Coexisting. Many individuals have a coexisting mental illness with the ones that are substance use or chemical dependency. They will have a coexisting mental illness. Defense mechanisms. Know the difference between denial, rationalization, and projection, and progressive nature. Know the difference between number 1 and number 2. Interventions under management. Active intervention must occur. Usually escalates if no one intervenes. Abusers of one substance often have built up tolerance to related drugs. Two of the most important questions that you can ask when gathering your nursing data is, when was your last drug use, and have you ever had problems with withdrawal, seizures, or DTs? When you're dealing with an intoxicated person in healthcare, monitor their LOC. Look at the possible nursing diagnoses on page 1773. And the one is that I want you to really remember is the high risk for violence, self-directed or directed at others. And then aspirin enhances the absorption of alcohol. An objective sign, an autonomic hyperactivity of alcohol withdrawal. An objective sign is hand tremors. In oral administration of methadone therapy, oral administration is usually liquid. It's usually required by law, and it's mixed with orange juice to mask the taste. An antabuse is given in the oral loading dose is 250 to 500 milligrams a day for 2 weeks, followed by a daily maintenance dose of 125 to 250 milligrams. And caffeine aggravates cystic breast disease. And let me see if there's anything else. Know the difference between macro and macropsia and micropsia. Know the difference between those. And also on page 1775, with methamphetamine, the anti-amphetamine stimulants and related drugs, they will have eyes tearing and mydriasis, and they will also have anhedonia, which is lack of enjoyment. And then the one drug that we will use in the CWA scale is Serex. For the CWA scale, it's Serex. S-E-R-A-X. Or OXAZEPAM. Oxapam. So for the CWA scale, it's Serex or Oxapam. And then also remember the clients are at high risk for suicide in alcohol withdrawal. And if I can think of anything else, I will let you know. But you guys have a great week. And I will not see you guys. Well, I'll see you guys next week. Because I'll see you on Monday. I'll see you next week, but have a great week.